Well, according to the National Institute of Mental Health, up to 25% of children and adolescents have a diagnosable anxiety disorder. Could you be one of them? Here with more information that you need to know about is Dr. Donna Kashani. Welcome back to the show, Donna.
Thank you.
Anxiety affects millions, right? Worldwide. Let's break down the numbers. Let's talk about this disorder.
Yes, and it actually ends up costing the United States alone about $42 million a year in healthcare, because a lot of people go to their doctor because their stomach hurts, they have headaches, they don't know what might be going on with physical symptoms they have, but they're rooted in anxiety disorders. And about 1/3 of people who have anxiety actually get it treated. And the sad thing is, it is a very treatable condition. So I think we need to improve the diagnostics related to this condition.
Would anxiety disorder, would that correlate to like low self-esteem? Is it?
Actually, a lot of people with anxiety disorders do have low self-esteem. Mm-hmm. They can have what we call anticipatory anxiety. They're the kind of person who's always, nervous or worried about what's going to come, what might happen, planning things way in advance, worrying about school, worrying about their social life.
Is that fear-based anxiety?
Well, I mean, if it's appropriate anxiety,
Yeah.
if you're a senior in high school and you're worried about college applications, that's an appropriate anxiety.
Yeah.
And in fact, a lot of the anxiety, even something like a separation anxiety in an 8-month-old to a preschooler, that's developmentally within the normal spectrum. So I think the other thing we do have to take into consideration, where is anxiety normal and appropriate, and where is it affecting your ability to function?
Okay, so break that down for us.
Okay, so when you have developmental anxiety, it would be in the context of, a 10-month-old whose mom's going into the kitchen and they start crying, that's normal. A preschooler who might not want to be dropped off, that's normal. When you have a 14-year-old who's refusing to go to school because they have so much separation anxiety from the parent and fear that the parent will die while they're at school, that's not healthy, and it's going to get in the way of that child being able to function. So also, the other thing is when you look at early grade school kids, they tend to have a lot of phobias, normal phobias, the dark. In our day, it was the boogeyman. Worrying about animals, spiders, snakes, dogs, clowns. Those can be, the strangest one I heard of was a child who was scared of wet towels. So they come in all sizes.
Wow. Wow, with 4 kids, I thought I've heard everything, but I've never heard that one. Okay, so then you have the developmental anxieties, and then you have anxieties that are not normal in adults. Let's talk about that.
Okay, so then moving forward to adolescence,
Yeah.
social anxiety actually peaks at age 15, and a lot of people don't know that. So social anxiety might manifest as being very comfortable with the family unit, but having a really hard time talking to anybody else outside of the family, and a fear of social situations. So if you can think about a child in high school, a lot of times their grade is rooted in class participation. So if they're not going to participate in class, and if they're too anxious to go talk to their teacher, much less even email the teacher, they're going to have a lot of problems. So social anxiety then tends to happen. OCD tends to peak at age 19. That's obsessive compulsive disorder. Worrying about or obsessing about something and then having an act that follows it for more than an hour a day. People sometimes do that related to
Give us an example.
Bathroom habits. I've had people say, I have to comb my hair for an hour in order to get it right, and these might be boys with short hair. So it's not, a typical teenage girl who's a little preoccupied with how they look.
Interesting.
So use the hour cutoff if the person is toilet habits, like I can't get too far away from a bathroom without getting anxious. That would be another example. Ruminative behavior, thinking about the same thing over and over again. Hoarding is a form of OCD.
Hoarding, you hear about that a lot.
Mm-hmm. Hoarding is a hard one to treat, actually. So then we move into panic attacks and generalized anxiety disorder. And generalized anxiety is just worrying about 2 or more life events for 6 months or more to an excessive degree, to the point that it affects you with insomnia, changes in your appetite. It can affect self-esteem. People can get muscle tension, back pain. I have teenagers who come in with back pain, and in fact, it's just muscle tension. They get easily fatigued. I think the majority of the population would say, hey, I get easily fatigued. So I think, again, you have to put it in context of what else might be going on.
Okay, so what about adults? What do you see the most with them as far as anxiety? Is it the hoarding?
No, hoarding is pretty rare, and OCD only affects about 1% of the population, and then a subcategory of OCD has hoarding behavior. So that's not very common, but my goodness, it is. I had a kid that I once saw who had the mother had terrible hoarding behavior, and they were very non-functional. There were 3 children in the home, and interestingly, they ended up having to have one of the individuals clean up their room, and then everybody else spent all their time in their room.
That is crazy. I don't understand that. Well, it affects so many people, and I'm sure it's a cause for insomnia, right?
Yes, because think about it, if you've ever had a time when you couldn't fall asleep and you felt very anxious, so you were having a hard time laying there in bed thinking and thinking and thinking about something during the day and ruminating, of course that's going to end up being rooted in anxiety potentially, as well as other things. It's not just anxiety that it's rooted in, but it can be any other symptom cluster like depression or anything else.
Got it. Interesting. Wow. So we talked about several types of anxiety. How do you treat somebody with an anxiety disorder?
Again, it's a very highly treatable condition, so you can look at psychotherapy, and that tends to be more like a behavioral modification type program. Medication and psychotherapy together have been found to be more effective than anything else. So the selective serotonin reuptake inhibitors, which are the Zoloft, Prozac, Lexapro, Celexa, all those medications we've all heard about. And then some family therapy might be indicated to see, if it is a social anxiety or a parental piece is involved. And then getting involved with the school if it is a child or adolescent. For the adults, it might need to be speaking with the partners and whoever else might be in the home. And the family therapy might be indicated there.
Can parents cause anxiety in their children?
That's a great question. I look at every subcategory of any condition, whether it's cancer or diabetes or whatnot. And when we look at anxiety, you have to look at it from a biopsychosocial perspective. The biological is the genetics, what runs in the family. If it runs in the family, yes, you are predisposing your child to that just by definition. The psychological is the temperament. Anybody who has more than one child knows that, boy, the kids have different temperaments from the womb, mothers will tell me. And then the social is the environment. So if you have a very highly anxious mother and a highly anxious child, that's actually going to be a really good breeding ground for high anxiety in the child. But anything else that might go on in the environment, that might be what's going on at school, what's going on at home between the parents, what's going on with the other siblings in the home. Anything else can affect that child socially and environmentally. So if you look at it from a genetic, a temperament, the temperament being the internalizer child versus the one who gets mad and the whole world knows it, and then the social environment, yes, we can all contribute and take away from anxiety in our loved ones.
And it could be a learned behavior as well, don't you think?
Absolutely.
I cannot tell you how many times I've seen an anxious mother and they have anxious, upset babies. It's like this whole, cyclical thing.
And they actually have studies where they look at the baby's face and facial expressions and how much they tighten their bodies. And the anxious mother does, in fact, set off, especially an anxious child. If you've got a chill kid, then it tends to go okay with the anxious mom.
Well, but if you have a chill mom, I'm 9 times out of 10, I feel like you're gonna have a chill baby and chill.
But even if they have an anxious baby, because the genetic factors coming from somewhere else, that more relaxed, at ease mother is able to relax that more anxious baby even.
Isn't that funny?
Yeah, it's amazing.
Wow. So again, anxiety affects how many people?
So anxiety affects up to 25% of the population. But what's fascinating, if you look at San Diego County, which is one of the most affluent counties in the United States, when you define affluence, an affluent household, as a combined family income of $150,000 or more in that family, 1 out of 3 girls graduating from high school coming from an affluent household do have an anxiety disorder. 1 out of 4 have a mood disorder.
That's because the media. The pressure's on women.
There's a lot of pressure, that's for sure, and we know that's a whole nother topic.
That's a whole nother topic, and since you're the expert, we'll talk about that the next time you come on. That'd be a great topic matter, right?
Okay.
And how it affects young ladies and young men.
Yes, absolutely.
Thank you.
Sure.
We'll be right back.